Hey everybody, it's Tammy, and we have like maybe a minute and a half or so till the webinar starts. I want to thank everyone who's here on time for being on time. And all of you guys can take this 90 seconds or whatever we have to adjust your volume. If you'll notice on your control panel, there's a place for your audio, and there's a place to adjust we won't have the cameras on today except for Jordan and William. You don't get to see me because I'm sitting here drinking beer and I don't want you to see that, but no. Hey, let me tell you, it's Shinerbach and all my Texas friends. If you know Shinerbach, you know what I mean. Okay, Shinerbach, that's right. No, but seriously, this is a good time for you to familiarize yourself with the control panel. If you have questions, there is a place that you can, a little box that you can put those questions in, and I will relay them to our guests today, and then we'll be able to answer them. Some of them will probably wait till the end. Some of them will be better off like during their presentation. And so we're about ready to go. William and Jordan, I'm just gonna go ahead and go through this little slides to kind of lighten the mood. So I want to thank all of you here today for the Insurance Happy Hour. I mean, the fact that you're here shows me that you're agents who are looking for all kinds of ways, as William and I discussed a little bit earlier, to balance out your practice and make the most money in the most efficient way. So this is just one thing that you can do to improve your practice, make more commissions. And also I want Jordan to talk about their fabulous lead program, because one of the emails I sent out, Jordan, was talking about how most agents are tired of throwing good money after bad leads, right? So we're going to talk about that today. So it's sponsored by, it's sponsored by 4.543. I got precise here. Billion years of climate change, right? So that's what's sponsoring today. Also, it's baseball season, and man, I love baseball season. It just makes things, the world is very unnormal here, and it's strange times, but baseball makes it seem all right. So there's no crying in insurance, there's no crying in baseball, right? We just don't allow it, especially if you're like me and you're an Astros fan, okay? Because we don't cry at all. And those of you who are new to me, Tammy DeLu, I am Tammy D. I am the editor of SafeMoneyTrends.com, and I'm also a licensed agent here in California, also in Arizona and Texas, and maybe some more in the future. But I feel your pain. I know your pain. I have done this business before, and we're always looking for new and innovative ways to market and have fun with it, right? Making insurance fun again. This is what we want to do. Look, these, Jordan, these are three of I have 6 nephews, and these are 3 of them. And that's the World Series trophy. If you're not an Astros fan, ha ha ha. But so we're sponsored by the World Series trophy today. We're also sponsored by life insurance. It's what people need, but they don't want, right? They don't want it. They don't want to talk to us about that. If you sell life insurance, you know what I mean. It's like they'll talk to you about all kinds of weird, kinky stuff, but they will not talk to you about life insurance. But we want to emphasize that it's a necessary product, and we need to be proud. If you're a life insurance agent, be proud of what you do. And also, this is serious. This is my friend Jennifer. This is Kansas 25, the album. 25 years already has passed. This is a work of art, and if you haven't heard of it or you haven't heard it, I totally encourage you to go to jenniferknapp.com. Got to put that plug in for her because she's been so good to me. And this is also sponsored by Bad Leads, okay? If you're on this call and you're telling me that you've never bought a bad lead in your life, or you've never been suckered in by lead salespeople, I don't believe you. I don't believe you. We've all done it. We've all done it, haven't we? I mean, come on, let's just admit it and quit it, right? So today, I am happy to bring to you this little special on some alternative lines of insurance. I mean, I'm always looking for other ways for agents to make money, right? Because you tell your clients oftentimes they need to diversify and they need to have multiple streams of income, right? Especially if you work with retirees. So I'm telling you, you need the same thing. This may be one of them. This may not resonate with you, but it's worth looking into. And my guest today, Jordan White, is one of the principals of, so describe yourself, Jordan. What is your actual role?
So yeah, I'm the principal of the FMO 116 Financial, and we specialize in marketplace alternative health insurance. And it's been a total blessing, to be a part of this industry. To give you an example, I mean, William was talking about this earlier. He was telling Tammy, like, within 3 years, of working on health insurance, he's got 33 years in the industry. Within that 3 years, he tripled his income, and I can say the same is true for me. And I've been able to help people to get something that they otherwise don't think is available because they don't know it's available. So
Right. And that's knowledge is key. You just pointed out the thing is there's so many things out there that can help us as agents and as people, and we just don't know about them. We just, And we also have William Allison. He mentioned William. You guys don't know who William is, but William, who are you and why should we possibly believe you?
Well, I've been in the industry 33 years, and I've learned all the things not to do.
That's the most important lesson, I think.
No, I mean, my career's been one of a lot of trial and error, and actually, I kind of stumbled upon private health insurance about 5 years ago, and I fell in love with it. And it's a phenomenal market. It's very explosive. Not everyone is doing it. So I love this industry. My whole family has been in the insurance industry. My father was a life insurance executive. So I started going to sales meetings when I was 7 years old. My wife's a licensed agent. We met at an insurance convention. We've been married 31 years. I have 3 sons in the industry that are licensed agents. And my daughter-in-law just became a licensed agent. I love this industry. I eat and breathe insurance. I love health insurance in particular, and it's just a lot of fun. And I didn't start having this much fun until about 5 years ago. So that's a little bit of my story and background.
Wow. Yeah. I mean, hey, so you've just in those brief sentences told these guys they're on this call because it's mostly men this time. My women didn't show up, but because we're working doing other things, I'm sure. But you just told that you can meet chicks in insurance. Hey, it's a chick magnet. Insurance agents are chick magnets. Okay, so guys, you thought we weren't paying attention to you, but we are. You say the I word and we're putty in your hands. So we're gonna try to, like you said, it's important right now with the world on the brink of all sorts of disasters that we have fun. And this is what I want to bring back, the MIFA thing, make insurance fun again, because people run away from you as it is when you tell them you're in insurance, except the chicks, right? But, so anyway, what we want to do today is give it over to Jordan and William to show you what they tell agents. Every time you call them, you're going to hear something similar to what they're going to tell you today, and you can make up your own mind. Is this worth my time? Is it worth the effort? Do you have to be an expert in health insurance to do this? No, there's ways you can make money without being one of these experts. So I'm going to turn it over. I'm going to make Jordan the presenter, and he's going to get a thing that says, "Are you sure you want to be the presenter?" Just put yes.
See.
Should pop up on your screen. You've been made the presenter.
Okay, it popped up something more, and then let me go in here. There we go.
Again, thanks everybody for being on. I really do appreciate it. I know you could have gone to happy hour and had bad tacos tonight, but you chose to come to this insurance happy hour. So did you get it?
I did. I got it. Okay.
He's the presenter, so take it away. And I'm just going to sit in the background. And if you guys have questions, again, type them into the little box, and I will relay them to our hosts.
Okay. So real quick, how can I? There we go. Can you see my screen?
Not yet.
Not yet. Okay. Let's see here. Okay.
And while Jordan's doing that, I'd like to ask a question. I know a lot of you on the call do financial planning, life insurance, probably do some Medicare, maybe final expense. I'm kind of guessing here, but one thing I'd like to say real quick is if you can help a family of four, say a couple with two kids that are in their upper 30s or early 40s, if you can help them save $500 to $600 a month on health insurance, do you think they'll buy life insurance from you, or what any other products that you want to offer them? And the answer to that is, of course they will. They'll love you for saving them that money, and it does lead to repeat sales. That's one of the things that I've learned about this. Health drives everything. It's like we got to solve that big problem first, and then once we got that solved, we can do all kinds of things. And that's what I love about this market.
Yeah, I agree. And speaking of issues and problems and solutions, the first thing I want to do is I want to get everyone familiarized with the problem. I mean, I feel like most everybody on here should understand the issue with the marketplace, right? High deductibles, high max out of pockets, little to no coverage, right? Until you spend an exorbitant amount of money, and then especially crap hits a fan, and very high premiums. So, like for instance, we're looking at a 40-year-old female, right? We'll add a spouse, we do a 40-year-old male, right? And so here's what things look like if someone doesn't have a subsidy, right? So we just up that income a little bit. So let me talk about our primary objective is to replace the marketplace, right? Because that's where we're going to make the most money. And also that's what's going to be best for the client. Our ancillary objective, if we can't complete the first one, is to make it better. So we can help anyone and everyone in any state with their health insurance, just so long as they don't qualify for Medicaid, right? So if they're not on Medicaid, we can help in some way. So I want to talk about the more affluent individuals, right? The people that don't qualify for marketplace health insurance subsidies, right? See, it says no savings up here. Can you all see this screen? Okay.
I can. Yeah, I can.
So look at this monthly premium, $737.90, a deductible of $7,500, and a max out of pocket of $9,400. So let's just look at the details quickly here. So we have some copays here before deductible is met, which is really good, right? We have, not great coverage on prescription stuff. Here's a real issue. Blood work is the #1 most common prescribed care item in the United States, right? When you get on medication, what happens? Your doctor prescribes blood work, right? To monitor you on that medication. When you get a checkup, you get blood work. Almost everything that you do, if you go to the doctor and you don't feel well, first thing they want to do, blood work, right? #1 most common prescribed care item in the United States. All of these are full price until deductible is met. That can be very expensive. Remember, we are contending with a $7,500 deductible, right? So you're telling me, or this plan is telling us, that you have no coverage for these things until you spend $7,500. And then after that, you only have 50% coverage until you hit your max out of pocket of $9,400. And when you hit that, you're done. But that's still $9,400. And they also have the $737.90 monthly premium that they need to contend with. If we go further down, we can see the more expensive stuff like the hospital stay, full price until deductible is met. This is the issue with the marketplace. If someone is making good money, they're penalized and they don't get to use a subsidy. They don't get to, they have to pay full price, right? And that's a huge issue, right? So these people are looking for something different. So we have typically 4 health insurance plans that we write, and between these 4 plans, we can come up with an innovative solution that is anywhere from 30 to 50% cheaper than the deductible and pays 4 to 8 times greater commissions than the marketplace would, which is a lot of money. So the alternative way is the best way. Marketplace isn't always the place. It isn't nearly even close to the place most of the time, right? And so I'm going to share my screen over here. We'll go with this screen. Here we go. So here's one of our primary plans that we like to write. It's called Philadelphia American. They're a subsidiary of New Era Life. They're out of Texas, and they have what are called defined benefits medical plans, meaning that these medical plans pay a specified benefit amount for each care item. And I want us to hone in on this 3-unit plan. So 3 units is the level of coverage, right? So here it is. Here it is at the top, 3-unit plan. Now notice if they're in the hospital for injury, days 1 through 3, it pays $10,500. And that isn't just for those 3 days. It's $10,500 each day for 3 days. So it's $31,500 of benefits if someone stays in the hospital for 3 days due to an injury. Day 4, it pays $8,250, and day 5 plus, it pays $6,000. The average cost for staying in a hospital is a little over $2,800. There is a new statistic. The average is $2,800 in the United States per day. So this pays above and beyond what will be needed for the hospital stay. These benefits also stack together with the surgical benefits. So this uses the most expensive hospital in Texas's surgical schedule. And this 3-unit plan is going to pay 300% above that. So Philadelphia American pays 2 people whenever possible. They pay the provider first, and then any excess or remaining benefits are paid to the insured, right? So to give you an example, and another thing is like they hand in their card at point of service, right? This isn't something where you submit a claim and you spend all your time not selling and writing more business, helping your clients submit claims. It isn't any of that. You hand in an insurance card, right? It works just like normal insurance. And so basically, let me see here. I have an EOB example of what it looks like to stay in the hospital. So this plan also uses a network, right? The network that it uses is First Health, which is a network that is owned by Aetna. It's a sub-network. The average network discount with First Health is typically 40%. Now, the discounts can be considerably higher as we see in this EOB here, but let's read the EOB. The total bill, so this is the total cost, $19,947.30. We see the network discount is $16,487.30, which means that only $34.60 needs to be paid to this hospital. There are $6,000 of benefits in here, okay? $34.60 was paid to the provider, and then the excess benefit of $2,540 was sent to the insured as a check in the mail. So not only did they have their whole medical bill paid, they actually ended up in the black on the whole thing. They actually got money. They didn't get money back, right? Because they handed an insurance card. Everything was paid for and they got a check. It's phenomenal.
It is. And Jordan, just one thing to add there. One of the things that helped me understand this better as I started learning about these plans is defined benefit means it's going to pay the exact same amount for each level of service every single time, no more, no less. So, I always like to clarify, these plans aren't designed for people to profit from them, but sometimes it does work out that way where they come out ahead. And that money can be used to cover other out-of-pocket medical expenses, or maybe they were off work a day or two or more, because most of our clientele are self-employed.
Absolutely, but I will say, when it comes to dealing with crap hitting the fan, when it comes to these catastrophic situations, this insurance will pay far better than anything on the marketplace, and it's far cheaper. And so when it comes to your out-of-pocket expectations for a catastrophic event, I'd say that more than likely, like I give it a 95% chance that your bills are going to be paid in full and you'll be getting an excess benefit, right? And the other 5% is your bills are paid in full. And so the specified disease is something that we partner this plan with. So when we write this plan, we write this optimum plan that we just looked at, the specified disease, the critical illness, and the accident together. And that creates a comprehensive health plan. Each of these policies together fill in the gaps that the others have. And so it makes something comprehensive for us. The specified disease is like a quasi stop loss plan. It covers the most common diseases that bankrupt most Americans today, right? It covers all of these things. And so it has a deductible, it has a very high deductible, and then it has a calendar year maximum. So typically we're selecting the 250,000 calendar year maximum, and typically we're either doing the 25,000 or the $50,000 deductible. And here's how that works. The deductible is deducted from the benefits. This is not money that the insured has to come up with. So the average cost for lung cancer in the United States is $180,000. So if we bump that up to $200,000 and say they have an above average cost and they're on the $250,000 calendar year max, and we give them a $25,000 deductible, it takes the total bills, the $200,000, it deducts or subtracts this deductible of $25,000 from it, and this policy by itself will pay out $175,000, right? And this working in conjunction with that optimum plan that we just looked at. That optimum plan has cancer benefits that are built into it, and it has a ton of other benefits that we didn't even go over. So between those two plans working together, there's more than enough coverage to take care of somebody if they end up with lung cancer. Same thing can be said with the critical illness that we package in here too. We didn't even look at that. So this creates a phenomenal benefit for 30 to 50% of the cost of a fully priced marketplace plan. And these plans just have a lot of flexibility in the way that you can create them.
Yeah, I was going to ask you, what's the underwriting like? I mean, what's the criteria, the knockouts or whatever? I mean,
so the underwriting is pretty lenient. I would say that, your typical stuff, right? So heart attack, cancer, stroke. But here's the thing with most of that stuff is they're only looking at a 5-year look back, right? For most of that stuff. And, sleep apnea, not a big deal. Mental health disorders, not a big deal. Tobacco, not a big deal. I mean, epilepsy, we can write epilepsy, that's not a big deal. Diabetics, we can write type 2 diabetics if they're not on insulin on Philadelphia American, but we have other plans that are guaranteed issue with no pre-X clause all day, every day, and we can write those plans for immediate coverage for the client, regardless of their health situation. So our diabetics that are type 1 or that are on insulin go on those plans, right?
perfect. We had a question. Oh,
Yeah,
sorry.
I'm sorry, go ahead.
I was just saying we had I don't know if you can answer this, William. How well are these? I get this because this is from Ransford, my buddy here in Southern California, and he wants to know how well do these plans work in California, which has the highest cost at 200% higher than the national average for
Well,
medical.
actually, we have a financial advisor in Orange County that started working with us last year, and he's done extremely well with us. And what he does is he talks to people about their portfolios and so, and talks to them how to save on health insurance, put extra money away for retirement and so forth. And he's done really well. I mean, the networks seem to work fairly well. I mean, we have a great provider search tool, can look up doctors and so forth. And actually with these plans, even if a doctor is not in network, sometimes it still works out pretty well, because as long as the doctor charges a reasonable amount for their services, even though they might not be contracted in the network and held to a certain amount, a lot of doctors today don't charge a lot of money and they just want to provide care. We do have those that do, so we need to avoid those. But we go on various websites. We have various resources where we can look up doctors and know what things cost and compare those costs and know what's going to work for that client. But in California, it has worked very well for us. And so I think that whether it's this plan or some of our other plans, California is a great place to operate because honestly, there's not a lot of these plans available out in California. A lot of our competitors are not in California. So you
Right.
may have
Yeah. Not that I blame them, but for other reasons other than the plan doesn't work, they're not here because it's just really difficult to do business here, no
you
matter what
know,
you're doing.
I know what you're saying, but I'll tell you this, a lot of very smart, strategic, type thinking insurance executives have figured out ways to offer these plans in various states like California or Oregon. Washington, I think, is the highest. Washington and New York are extremely difficult, even more so than California. But there's a lot of creativity in this market, figuring out a way to get around the ACA and so forth. Not the dodge regulation, but to work within the regulations and offer superior benefits to what's out there on the marketplace.
Yeah. And there's a hunger for it, I'm sure, because people here are just trying to.
Yeah, yeah. If you can cut someone's premium in half, they're listening. Then they're just going to decide, okay, do I trust this or not? And our job as agents and advisors is to do what? It's to make them understand the benefits to where they want them and they trust us. That's to me the work that we have to do is to convince them that we have the right solution for them and that they can really trust these plans.
Yeah, and going on the California thing about how expensive these plans are. So these are all four of these plans added together. California has a different variation of these plans. So actually, California would be a little bit cheaper than what's displayed here. But what I did was I quoted, right? This is insurance. This is an insured male non-tobacco, right? And so here are the ages 25, 35, 45, 55, 63, right? And here's the total cost with all four plans wrapped up together 25, 35, 45, 55, 63. And so for insured and spouse, I did same age, right? Non-tobacco for both 25, 35, 45, 55, 63. And here are those over here, right? And here's for children, right? Insured plus children, not insured and spouse. And then here is for family. So these prices are very competitive. And what I've done is I've actually ramped up the plan to some of its highest limits, right? As far as the benefits that I can give. So we can scale down these plans and make these premiums even cheaper than what they are and still give the insured phenomenal coverage. So just to keep that in mind that these are kind of to the max, right, as far as benefits go. So I feel like that these premiums, I know that these premiums are extremely competitive. So in all states, really. And so another thing to kind of look at, is what do you make? Why do you want to write this? Well, here's why you want to write this. So here's the compensation, right, for those same ages, right? Insured male non-tobacco. Same setup. Here's the comp on that. And this is first year, right? So the least amount you can get is $367.15. And then here's for a 35-year-old, 45, 55, 63, right? And then here is insured plus spouse, right? That's a lot of money. Insured plus children. And then here's family, right? And so if we look at the actual average of this, right, it's a conservative average. We're looking at $948.17 in first year commissions, which is a lot. And the renewals on these plans are pretty fantastic too. So the national average for life insurance commissions, and we're talking about the whole average, right, is $50 a month. So $600 in first year commissions, right, on your typical 100% life insurance contract. This is almost double that.
Well, that's pretty nice. And I mean, it's good. But for me, as a marketer, the first thing I noticed, William and Jordan, is like you said, if you can help somebody save that kind of money when people are struggling right now, you become a hero. You are the hero agent. and everything else you say after that holds weight. And you become a trusted advisor for all sorts of things. So if you're selling annuities, like for example, how would an annuity salesperson leverage this, in your opinion, Jordan? What if they don't know anything about health insurance? I mean, how are they going to make this work?
Well, if someone's selling an annuity and they're trying to break into the health insurance market, there are two ways that they can do it, right? They can become a referral partner. I don't know why that happened. They can become a referral partner. That happens on Zoom too. I don't understand it. But they can become a referral partner. They can refer the business and split the comp, right? Because there's a place in there for you to put agent numbers so you can split comp. Or they can learn it, right? We have great trainings. We have great trainings Monday through Wednesday from 2 to 3 Central. We also have a recording of all 3 of those trainings. So actually as part of our contracting process, we send out those recorded trainings and we send out the training link. So the great thing about working with us is that we're non-captive, right? So you can do whatever the hell you want to do, right? We're not going to tell you what to do and what you can't do. Our goal is to treat you so well that you want to write with us and you want to write a lot with us, right? So we'll support you throughout the whole process. If you need extra training, we're there. If you need help with a sale, we're there, right? We have your back and we have the resources to make that happen. And we also have the technology, right? We've got, all sorts of stuff. And as Tammy had previously mentioned, we have leads. So we literally have, plucked the 4 carriers that we could be innovative with to create a comprehensive health plan, as well as the resources to support you to make you a successful health insurance agent. So it's a long-winded answer, but there's my answer.
So tell us a little bit about the other. Okay, so we obviously in this webinar, we don't have a lot of time to go over everything they have, but they have a lot of solutions. It's not just Philadelphia American is the most obvious choice, but I'm not sure what's available in every state, but you might live in a state where you can't sell that, or for whatever reason, it's not competitive. They have 3 other carriers they work with, but also they have some interesting technology that can help people further, which is that, what's it called again? Where you do the negotiation, the price negotiation, and
yes, absolutely.
That's a cost saving thing. So it makes it where you're able to basically, there's not many people you can't help.
We have partnered with some people to make Healthcare Ninja. This has been a game changer for us. And it's a lot easier for me to just quickly show you the video than for me to try to explain it. It's only a couple minutes long. So here it is.
100 million Americans are entitled to free or discounted hospital care, yet few know it. Nonprofit hospitals are required to give free care, yet they skirt their obligation to do so. Let Hospital Bill Eraser take on the burden of dealing with the hospital bill for you. The free care zone is in the blue part of this chart. It's based on household income and family size. That's free care waiting to be had at thousands of hospitals. Many hospitals have a sliding scale discount for care, up to double the dollar amount shown. Hospital Bill Eraser's free care worksheet has created a savings calculator so that the real amount owed is shown. Hospital Bill Eraser has indexed the financial assistance, phone numbers, applications, and policies for each hospital. This permits us to quickly begin to erase a hospital bill and explore the details of a financial assistance policy to assure the best outcome for our members. Hospital Bill Eraser also can be used proactively for elective care via our free care map. For example, by knowing a pregnant woman's household income and number of family members, Hospital Bill Eraser can quickly determine which hospitals can provide her a free delivery. No hospital permits pre-approval for financial aid, yet our detailed review and analytics of each hospital greatly facilitates free care. The application to erase the bill can be completed, ready, and waiting. Hospital Bill Eraser has a medical bill negotiation wizard ready to help detect the all too common billing impropriety associated with inflated surprise hospital bills. The Eraser software wizard helps analyze 20 different opportunities to lower a hospital bill and automatically generates a medical bill negotiation letter. Kick back, relax, let us take on the hospital for you. Hospital Bill Eraser is here to help all nonprofit hospitals honor and fulfill their nonprofit obligation to better serve their communities by erasing your medical bill.
I just thought this was really cool because it gives you an extra tool to help people. You know,
Yes,
it's
indeed.
just,
You know, we've been working with them for the past 3 years, and they've been batting 1,000 for us. So we actually had a gentleman in Florida that went to Cleveland Clinic, and he was on some plan, and he ended up with a $13,000 ER bill, right? He called us and he asked for help with it. Now this guy is a multimillionaire, so he didn't qualify for any financial assistance policies at all, right? So we got him in touch with Healthcare Ninja. They said that they'd help, and they did. That $13,000 ER bill was reduced to a whopping 0 because what they did is they found 6 federal violations, and they threatened to report that hospital to the Department of Health and Human Services, the Attorney General, and the IRS because they actually had some 501c3 violations. And they threatened to sue the crap out of the hospital. You know, the wheels of bureaucracy at a hospital turn very, very slowly. This guy's bill was reduced to 0 within 5 days of Healthcare Ninja making those threats. And we have scores and scores of other examples of how this works. So this works for the super poor person under 501R, tax code 501R, and it works for the rich person because if there's anything that we can count on in a hospital bill, it's fraud. We can count on a hospital bill and fraud in a hospital bill just like we can taxes and death. So it's there. It's
There's
always
just a lot of, one thing I'll just contribute here. There's a lot of shenanigans that go on with medical billing, and when you get a medical bill, you see all these codes and acronyms, and you're just like, you see the amounts. That's what gets your attention. But you don't have a clue of what you're reading. I mean, I don't. I mean, I know I don't, but I know where I can get some help. But with all of that said, honestly, there's a tremendous amount of misinformation and fraud in those medical bills. We caught one recently and took it to Care Guide Advocates, and what had happened is this hospital actually has their own codes. They don't even recognize what we call CPT codes, which are like diagnostic codes. They have their own codes. That practice, from what I was told, is totally illegal. And so we called them out on it, and we were able to get that bill down to 0. It's just truly amazing. We had another guy in Florida that was in a hospital for COVID, had a $68,000 bill. The hospital's billing this guy and making him put up a credit card to pay down this bill, but they were receiving COVID relief funds from the government. So they're double dipping.
oh, yeah. Why does that not surprise me?
So, there's a lot of things that go on in this world, but, here's the thing that I want to emphasize. Everything that we're talking about here is not hard. It's very easy, and it's very easy to implement into the business that you have right now. I've been in the industry 33 years. I knew nothing about health insurance until I started doing this. But I saw how much fun it was and how much I could help people and how gratifying it was. And I could make a lot of money doing it. The thing that I think about, what I think about health insurance is this: the perception traditionally is this: low compensation, low commissions, a lot of maintenance, a lot of service work, that kind of thing. And it's actually just the opposite. We don't hear from most of our clients because most of them are fairly healthy to begin with, and they really don't use their plans that much. Some do, but a lot of them are mostly healthy and they're just glad to have coverage in case something goes wrong, in case of a major health event. But a lot of people we just never hear from for years. The compensation, as Jordan just showed you, is much higher than I think most people would expect. And so it's really a phenomenal market. People don't buy health insurance and then just cancel it. They don't. So the retention level is really high because people know that, oh gosh, if something happens, I got to go to the hospital. I got to have my health insurance. So
all good points too, that yeah, retention is really critical, a critical thing.
Yeah, I
it's
mean,
what insurance people are going to use that you're going to write that they're going to use. Life
Okay.
insurance, plan on using it, right? They hope they don't.
Well, you are gonna, yeah, well, that's kind of an inevitable thing. If you keep it long enough, you're gonna,
Yeah, someday,
yeah.
someday, but I mean, these are people who are going to use these plans more immediately, so they're not going to cancel them because they know they need it for the most part.
Absolutely. If you
But
don't
a
want
lot
to go
of,
into bankruptcy.
yeah, and that's the point, is that people want to protect themselves from financial ruin, and that's the key. Well, if they're trying to protect themselves from financial ruin and be prosperous, doesn't that fit into financial planning? Isn't that
Absolutely.
something? I
Well,
mean,
I
yeah,
think that it's essential because it is risk protect. It is, you're supposed to be managing risk as an insurance agent. It doesn't matter what line you are. And
yeah.
to me, that's the ultimate risk management. But I want to ask you a little bit because, people are asking questions about your back office and also about your lead system. As agents, okay, agents, leads are like heroin for agents, okay? And I've always said that. I've been in the market. I've been an agent since 1996, and I've been working marketing, trying to do lead generation. And it is, once you get a couple of good ones, it's like you're looking for the brass ring for the rest of your life. What are the leads like? And also Timothy wants to know, is there going to be, what's the history of rate increases? That's a good question with Philadelphia American. And, like, describe what you're doing for agents on the back end that makes you a little different.
yeah, absolutely. So Philadelphia American actually, excuse me, actually partnered with the lead vendor, and they themselves beta tested it for about a year, a little over a year, before they rolled it out to us. They rolled it out to us February 1st, a couple months ago. And they're targeting small business owners that have 10 employees or less that are over 400% of the FPL. So that's the federal poverty level. So if you're over 400% of that federal poverty level, right, and that includes calculations on your family size, then you don't qualify for a subsidy on the marketplace. So they're reaching out to people that we are extremely interested in talking to, right? And so they're asking qualifying questions, right? So this is specifically for Philadelphia American. Remember, Philadelphia American's parent company is New Era Alive. So they're calling it New Era Insurance, right? They talk about the hot points, but here's what they're asking that small business owner that doesn't qualify for the marketplace and that has 10 employees or less. They're asking them who they have their coverage through now. They're asking some underwriting questions for us to make sure that they're a good fit, right? They're asking, who are we getting coverage for your family? Do you have any employees you'd like to cover? So some of these leads are going to be employer groups, right? We looked at $948 for writing, an individual, or well, I guess if you averaged it out, it would be like a couple, right? Now we're talking about writing everyone's family, right, that is in the employer group. They're also asking, what the coverage is that they have and how much are they spending a month in their coverage. So we know what the cost is, right, that they're paying, and we know the price that we have to beat before we even talk to them. And if they don't have health insurance, they're asking this awesome qualifying question right here. Can you afford $200 a month per person, right? And so if only if they've answered these questions correctly that would benefit us the most, does that become a qualified lead for us, right? And these are people on the phone already talking to them. So these leads have already been engaged, right? They're already willing to pick up the phone and talk to somebody and give them this information. So at that point, it's a lead for us. And here's what the leads look like, right? So here's the cost. The 1 to 7 days, they're actually running a special. It's $30 a piece. 30 to 60 days is $15 a piece. 60 to 90 days is $10 a piece. And 90 plus days is $5 a piece. Now, the thing about these leads is that they are not recycled, right? These are leads that they've held on to in their system that they haven't given out to any agent. So they are non-recycled leads. And we've had great success with them. I mean, Philadelphia American is a multi-billion-dollar insurance company, right? They're not a small player, right? Just because you haven't heard them doesn't mean they're not a big player, right? And they have beta tested these and put their sign and seal of approval on these to be leads to write specifically Philadelphia American business. Now, what happens if you run into somebody that doesn't qualify for Philadelphia American that may qualify for one of our other plans? Well, you have complete freedom to write them. You just need to make sure and give Philadelphia American the first rights to it, right? Try Philadelphia American first, look in the underwriting guide. If they won't pass upon further investigation, then you can go and write them elsewhere.
And this,
Ordinance-
and this, yeah. Oh, sorry, I was going to say, and this is where it becomes really critical that you develop a true relationship with the lead and put them in a drip system and tell them about everything else that you do for, for them. You want all of the lines of business for these people. You don't want to stop here. You want to be their only agent, right? And so we have other tools that are available to people on this call that are from me. And I make you the promise that if you work with us, if you decide to be an agent with us, you will get a couple of those tools for free right away, just for becoming an agent, because we want you to be successful. I never understand, and maybe you don't understand this, William, you can explain it to me. I never understand FMOs and IMOs that they just recruit, but they don't do anything after that. They just.
Yeah, I know, and it's frustrating because a lot of them I don't think really understand. To me, this is a relationship business. Okay, some of my best friends like Jordan, we're in the industry together. We work together. We talk almost daily. I mean, so I love what I do, and I love like getting to know agents, and I love their stories. I mean, I just, it's what I do. It's what I love to do. And a lot of them aren't like that, I guess. I mean, a lot of them are just recruit, and try to find people that produce. I don't, it makes it hard on the agent to really know who they want to work with. But I think calls like this are really important because they can show agents and advisors value and what you're doing and your strategy for bringing in business, and if that's going to fit the way they want to operate within their own practice. That's what I got out of a lot of these calls over the years. One thing I'd like to talk about really quickly, though, is what I call free leads. And I like the old saying that Larry Bird used to have. He used to say, as a basketball player, you create your luck, and what he meant by that is you position yourself, you put yourself in a position to succeed. And really what he was saying is it's not luck, it's ahead, it's strategic, it's, being smart about what you're doing. But what I like to do is I like to build relationships and find leads that way. I mean, we all know the referral market is very successful. I mean, anybody on here that's a successful life insurance agent, I'm sure, knows that. But in the health insurance industry, it's a little bit, and I think it's highly effective because people really need these coverages, okay? And they need them immediately. They're sick and tired of these high premiums. They're tired of like a family paying, $2,800 a month. And I'm speaking to mine that I just helped back at the end of the year, marketplace plan paying $800 a month for his two children that are in college. I mean, that's a lot of money to pay for health insurance. But what's really neat is think about this for a second. what part of the industry doesn't really favor or health insurance? What part of our industry doesn't really see it as a great market? Well, the answer to that is the property and casualty market. So like all of these independent agents out there, they typically don't write health insurance, which makes them a phenomenally great resource because they have clients. And we actually train on this and how to approach them and how to develop referral partnerships. And you can do it a couple of different ways. You can do all the work and, pay them like, after you've written something, after you've gotten paid, you can pay them, for giving you the lead, right? Or you can contract them, which is what we do a lot, is that we'll contract them. We'll say, hey, we'll do all the work. And as Jordan was talking about earlier, we'll put their number in when we write the business and split it with them. That way they get paid directly from the insurance company. They get renewals for that business. I mean, they love it. I call it mailbox money because they don't have to do anything. The key to making that work is trust. You've got to make them feel like you really have their clients' best heart, the best interest at heart is what I was trying to say. In that, you're going to do the right things. You're going to offer the right coverages. You put them in a particular coverage just to make a sale. And that's something that's really important to us because, all we have at the end of the day is our reputation. And that's just, really essential that we write people the right coverage, the right products, and help them find the right coverage for them and their families. So I love free leads. I hate spending money on leads. I'll just admit it. Leads are great. Like Jordan was talking about, Philadelphia American has a system that does some very unique things in the lead market. I love talking to people. I love just getting out there and maybe meeting a PNC agent, picking up the phone and calling them, messaging them maybe on LinkedIn or something like that. So there's a lot of ways to create leads in this part of the business. The health insurance market, to me, is very different in the sense that it's very responsive. You get people to really take this more seriously than in other parts of the industry where they really respond like, yeah, you've got something, like, yeah, you can help me save on health insurance. So there are times where we are saving people money, and on what they're already spending. That's huge. They're already spending huge sums of money for the premiums. So we're not selling them on spending more money a lot of times. A lot of times we're selling them on a better solution, lower cost, better access to healthcare.
And that's absolutely critical. Do we have time for a couple more questions? Because like you said, these guys do so much. And I just wanted to introduce them to all of you so that you would take the time to contact them. We're going to tell you how to do that in a minute. And we're also going to draw for the person that won a little piece of silver. But here's a question. What does the underwriting time turnaround look like, Jordan, on Philadelphia American? I'm assuming that's what he's talking about.
Yeah, so underwriting with Philadelphia American typically is 7 days. So the day that you submit the app, you can actually get a coverage effective date about a week after that. And you can actually write the business all the way out to 90 days if you wanted to. Let's see, and something that I wanted to show y'all really quick with without taking up too much time. Philadelphia American's a unique health insurance in the way that it's innovative in helping our clients, right? So what I want to show you is this is another one of our health insurance carriers. It's called Datego/America's Choice, right? Same company. These are more traditional this is a traditional major medical plan, right? So we have major medical plans that we can write all year long that don't have a SEP, don't have a special enrollment period. So folks that don't have a qualifying life event for a special enrollment period that want to change their plan, they can change into something like this, right? And this is actually pretty price competitive to the marketplace. It's not nearly as price competitive as Philadelphia American, but it's still typically less than what you pay on the marketplace. And it's phenomenal. And we have other benefits too. And they have it's a $0.
I'm sorry, I want to mention something real quick. Could you slide over to the HSA 3500? I want to just mention this and yeah, that right, just over to the right there, that HSA plan, my wife and I are on that. I'm 59, she's 61. We pay $1,100 a month for that plan. If you go to the marketplace, the plan is probably about 2,600.
It's insane.
It's a good savings. I mean, yeah, these are wonderful plans. Do you know, there's a bunch of more questions on here. One of them is, other than, this is a good question from Zoe, other than the fact that you can't have a prospect that's on Medicaid or qualified for Medicaid, what's the ideal person that this is going to really, you're looking for, that they're looking for prospect wise?
So our ideal client is someone that makes over 400% of the FPL, or federal poverty level, and it is relatively healthy, so healthy to semi-healthy. That's our ideal client. So, you may ask, what is the federal poverty level, right? Well, you can always look it up, just Google it, and I'll show it to you.
I like it when they're making $50,000 a year or more, because if they make less than that, a lot of times they qualify for marketplace. And so those are not really typically good clients or good prospects for us. But a typical prospect is a real estate agent,
Truck
maybe
driver.
a truck driver, plumbers, say a husband and wife that own a heat and air business. They may have 2 or 3 employees. We can write them. We can do list bill and write group. But they make too much money really for the marketplace. And really what Jordan was saying earlier that makes a lot of sense is these are folks that are like, man, these premiums are high if you don't get a subsidy. And really the coverage is not very good because of the poor access. HMO only coverage, the deductibles are $8,000-9,000. And people are just like, these for the money, they just don't make much sense if you're going to pay the full premium. And so why, these types of plans are so popular among, I don't want to say affluent people, because I wouldn't say they're in that category. Above 50,000, maybe 60,000, or in California 70 or whatever. I know the incomes are higher out there. So they're just looking for a better deal. These are people that can afford to pay more. They just don't want to. And I think that's a very key distinction. Just because they can afford it doesn't mean they want to spend that money. They're looking for a good deal. They're looking for a good value.
Like independent contractors would be probably a good group.
Yes.
Blue collar people, I think, would be excellent, because the tradespeople are making far above 50,000, and they hate overpaying for stuff. That's just the nature.
Yeah, we've written travel nurses are very popular because they typically, think of it like this: anybody that doesn't have access to group medical and makes about 50,000 is probably going to be a good target if they're in good health.
Perfect. Here's one other one. Do all the carriers that you work with, do they have easy to do like e-apps where you can walk it through, or is there a lot of, what's the, yeah, how much work are you gonna have to do to get one of these policies through?
Hey, I'll tell you, you want to know how much easier it is to me? I started in the industry when we had paper apps, and we actually had a carbon for the app so that everybody get a copy. So,
Good
yeah,
Lord, that seems that's ancient.
Yeah, it's 1991. I always laugh about that because I appreciate technology more than you can imagine. It's all, most of our business is virtual now. I mean, a lot of our agents never even meet with clients. They do Zoom calls, and that's not even required. A lot of times it's a phone call, but they're all done over company, forms that enrollment app, and it's a fairly easy process. Jordan,
Yeah. I'll put it this way: to enroll someone into Philadelphia American takes about 15 minutes.
Yeah.
To enroll them into our other 3 carriers takes about 10 minutes.
Yeah.
Wow, that's great. I mean, so that's very helpful, because a lot of these, you're adding an extra line of insurance to your practice, and you're balancing things out, and you're leveraging this. And I think it's just going to be a win for most agents. But again, if you don't want to actually learn all this yourself, you're more than welcome to become a referral partner. And maybe your P&C agent. I know I invited a lot of P&C agents to this call. Maybe your P&C agent, you really don't want to deal with it, but you wouldn't mind having a little extra money. So you should definitely talk to these guys. And we're going to tell you, because I think, hang on a second, I think I put it on here. I did at the very end. I'm gonna show my screen again, but I gotta hang on, show my screen. You
Hey,
got
Tim, while you're doing that, there's one thing I did want to say. I feel like this market is in its infancy. And what I mean by that is a lot of people just don't know about it. I mean, they don't realize they can buy health insurance outside the marketplace. And a lot of agents don't know about it.
Guess what? I didn't know
A lot
that.
of P&C agencies, a lot of them don't even know that you can do this. And the health insurance, like the group, or I'm sorry, the major medical plans like Jordan was showing there, what those are, so that you'll understand and know, those are group medical plans that are written all the way down to one individual. So a group of one. And that's how they're getting around the Affordable Care Act. And maybe that's not the right wording saying getting around, but that's how they're being compliant and still underwriting the coverage and providing better coverage. Because think about it, if something's underwritten, that means the insurance company gets to see what your health is like. Oh, okay, you're in good health, we'll give you a great deal because you're low risk. Oh, you're in bad health, okay, we're going to charge more because, hey, we're taking on more risk. I mean, that's how the insurance world works. But I think this is a phenomenal opportunity for agents and advisors who are just learning about this, because everybody thinks the marketplace is where you have to go, and it's not. But I bet you 80%, 90% of people out in the general public believe that. And
I thought for the longest time till I met Jordan, really, I didn't really understand that you had that option.
yeah,
I
yeah.
just thought it was all or nothing. So, I mean, I know we could talk about this stuff all day long, and we could geek out on the insurance world, but we wanted to give you just a taste. All of you guys that have bothered watching this, and thank you so much. We want to give you a taste of what's out there, because the months ahead are going to be challenging for all of us in this whole country and on a lot of levels. But the more money that you can make now, the more well established you can become, and the better you can get at marketing yourself. That's what I do. I mean, I help agents just find solutions to their marketing issues. And so if you were out there drinking and carousing and you came in from the rain to come and be with us, I really appreciate it. Never take yourself too seriously. This is what I always tell people. I mean, but what we want to tell you is there's a link down there. We're going to send it to everybody. So I want you to check your inboxes. There's a link down below the agent there. And that's the link that you can go and fill out a more complete application. If you're interested in doing this, you can either reach out to me, Tammy at Rebel Agent Depot, DEPOT, Tammy at rebelagentdepot.com, or you can go to this link and you will get a copy of this recording. So don't worry if you can't write fast enough. And then once you've talked to me, then we're going to decide, is this going to be good for you or not? And if it's not, no hard feelings. I just want you to know about it. But if it seems like something that you want to do, then we will be glad to help you. And so here's what I'm going to do right now. I'm going to pick somebody that won the silver. The silver is the real money, right? Precious metals, right, Jordan?
Yeah, absolutely.
Feels like money, looks like money, and the price keeps going up. When I started with silver, they thought I was crazy. I bought it at $12. Now it's almost 29. It's 28 something today. So the person that is going to win the silver, and I just put everybody's name in a hat that showed up, and I pulling it out. I'm going to laugh myself silly at this one because this person knows. I think he knows. He's been on 1,000,001 of my calls. It's Mark Santelman. So Mark Santelman, you are the silver winner. And what you have to do, Mark, is send me an email with your correct mailing address, and I will send you a piece of my silver. But it's not just any silver. This is special. It's scored into 4 even pieces so that you can put it in a vise. You know, when it hits the fan, you can put it in a vise and break it into 4 pieces. How's that, huh? So it's fungible, right? It's divisible. It's you know, so that is Mark, and then everybody else, you know, you get another gift from me. And here's the gift. Everyone that's on the call that wants to do this and wants to work with these guys or try it out or contract or whatever, I will put you on, I'll give you a custom bio on safemoneytrends.com. And usually I charge for that. And you can go to safemoney.com and look at our authors and you'll see what those are like. And I will also give you an article that I will custom write for you. And I do not use AI. I write it from scratch. So if you contract, you'll get that. And that will sort of launch you into the Jordan. It's to get people's reputation out there and get them noticed on search. Because if you want, I think health insurance would be a great term to get noticed for. So, because if I was a business owner and I was in Indiana, I'd look for best health care plans in Indiana or whatever. I would want to find you. And so we're going to help you get found. And there'll be more of these webinars to introduce you to people like Jordan and like William who can help you, and they want to help you. I mean, I'm really convinced of that. I try to work with the best people. So I want to thank all of you wonderful agents, you know, who've been following me all these years. This is probably my 200th webinar, somewhere in that vicinity, 200 or 300 I've done over the years. And some of you have been on every one of them. You should have been out there getting prospects, okay? But okay, never mind. but anyway, thank you. Thanks, Jordan, and thanks, William. Like I said, we may just do more webinars, just drill down deep into some of these products, like the technology, you know, like the what's it called, the bill eraser, in the future. But for now, we're just going to give you just a taste of what you can do in the healthcare space. So I want to thank my presenters today, Jordan and William. You guys are great, and I hope to send some of these fine agents over to you soon. This is Tammy DeLu with SafeMoneyTrends.com. Thanks for being on the call. I hope you got something out of it. I hope you got a few laughs here and there, and I hope that you want to become a superhero in this the coming year. So thank you, William.
Thank
you,
you.
Jordan. Thank you, Jordan.
So much,
and yeah, and like you said, expect in your inboxes, guys. Check those inboxes, because I'm going to be sending you links where you can go hook up with them and just, you know, just explore it. You know, we're not a hard sell recruiting thing here. So don't expect us to do that. But thank you. And thanks, Zoe and Ransford, for asking so many wonderful questions. I appreciate it. Take care, and God bless you, everyone.
Thank you.
Take care. Have a good evening.